story. In today's health news, a new study shows popular weight loss drugs and diabetes medications like Ozempic and Wegovy may also help lower the risk of certain cancers. The research focused on people with type 2 diabetes and their chance of getting cancers linked to obesity. Our chief health editor, Dr. Partha Nandi, here now to explain the findings. Dr. Nandi, this sounds like great news.
Yeah, I love giving good news. I'm excited about this. It's very encouraging. We've talked a lot about these semaglutide medications that belong to a drug class called GLP-1s. Now, as you mentioned, Ozempic and Wegovy are amongst the most popular. This new study was published in the Journal of American Medical Association and was based on the medical records of a lot of people, 1.7 million folks with type 2 diabetes over a period of 13 years. And the research found this, that patients who took the GLP-1 drugs were less likely to develop some forms of cancer associated with obesity, which is great. Now, there are 13 types of cancer that overweight or obese people are higher risk of getting, right? That risk increases the longer a person is overweight and the more excess weight they gain. In fact, in the U.S., the Centers for Disease Control says that about 40% of new cancer diagnoses are associated with excess weight. That's a lot. So the study found that people with type 2 diabetes who were taking these GLP-1 drugs were significantly less likely to be diagnosed with 10 of these cancers compared to those who just took insulin. These include gallbladder, pancreatic, colorectal, ovarian, esophageal, endometrial, liver, and kidney cancer, along with meningioma and multiple myeloma. Amazingly, the risk was cut, Carolyn, by 24 to 65%, depending on the type of cancer. So pretty exciting stuff.
I didn't even know obesity caused so many cancers or were linked to so many cancers. Now, according to this study, 3 cancers linked to obesity were not impacted by these medications. So what are researchers saying?
Yeah, so nothing's perfect, right? So surprisingly, the GLP-1 treatment did not reduce the risk of cancer, that's most associated with obesity, which is postmenopausal breast cancer. The research also found that the risk was not lowered for stomach cancer and thyroid cancer. In fact, some studies have shown that these semaglutide medications may interact with the body's insulin production in a way that may be harmful to the thyroid. On another interesting note, I would say the new study also found that the cancer risk for folks with type 2 diabetes was the same amongst those who received the GLP-1 treatment and others who took metformin, which is another diabetes drug that lowers blood sugar levels. So while this is exciting, right, it's an exciting development, there's still more research and clinical trials that must be done to learn more about the potential benefits of these GLP-1 drugs in reducing the risk of certain cancers. In the meantime, right, I always say this to my patients, do what you can to reduce your weight, maintain a healthy weight by eating right, exercising, and living a healthy lifestyle. As more information comes in, we'll get it to you. But I think it's encouraging, right, that, if we can make a dent in this, we could really save some lives.
I mean, we're learning more and more about these drugs. I mean, lowering the risk of heart disease and stroke and cancer, too.
I love it.
Yeah,
I love
it. Plus.
Exactly.
Thank you, Dr. Nandi, as always. We love it. And if you have a health question for the doctor, you can send an email to Dr. Nandi at askdrnandi.com, or you can send it to us on Facebook or on X. Mike?